Good morning/afternoon, everyone. Today, we're diving into a critical and complex issue, understanding addiction and reforming drug policy in America. Our focus will be on addressing common misconceptions, breaking down the stigma, and highlighting the disparities that affect so many communities. Most importantly, we'll explore how we can move towards evidence-based public health approaches that truly make a difference. I'm excited to share insights and ideas that can help shape a more informed and compassionate conversation around this topic. Let's get started. Addiction in America is often misunderstood, which can lead to policies and social responses that miss the mark. Many people still see addiction as simply a lack of willpower or a moral failing, but this overlooks the fact that addiction is a complex health issue. These misunderstandings create stigma, making it harder for those affected to seek help and for society to adopt compassionate, evidence-based prevention and treatment strategies. To make real progress, we need to move past these stereotypes and develop a deeper understanding of the medical and social factors that influence addiction and recovery. Addiction is best understood as a chronic brain disease that changes the neural circuits in our brain responsible for reward, motivation, and self-control. This means it's not just a matter of personal choice or a sign of moral weakness. These changes in the brain can last long after someone stops using substances, which is why relapse is so common. When we recognize addiction as a medical condition, it helps us align treatment approaches with the latest scientific understanding. Importantly, seeing addiction this way also reduces the stigma and blame that people with substance use disorders often face, making it easier to support their recovery. When we look at how society views addiction, it's often seen as a personal failure. This perspective marginalizes those struggling with addiction and makes them less likely to seek help. This negative perception doesn't just affect individuals, it also shapes policy decisions. Instead of focusing on supportive services, policies tend to lean towards punishment. This stigma extends beyond policy, leading to discrimination in healthcare, employment, and the legal system. These forms of discrimination create even more hurdles for people trying to recover. Ultimately, stigma stands as a significant barrier, preventing effective public health interventions and making recovery much harder to achieve. American drug policy in the United States has its roots in the War on Drugs, which started in the 1970s. This initiative placed a strong emphasis on criminalizing drug use and possession. From the beginning, the approach was centered around strict law enforcement, including mandatory sentencing laws, but it paid little attention to treatment or rehabilitation for individuals struggling with addiction. Essentially, the system prioritizes punishment over addressing the underlying health issues that contribute to drug abuse. This has resulted in a framework that often overlooks prevention and fails to provide comprehensive care to those affected. Overall, the focus remains heavily on criminalization rather than adopting more holistic and health-oriented solutions. When we look at current drug policies, there are several major critiques we need to consider. First, despite the extensive efforts through the War on Drugs, these policies have not succeeded in significantly reducing drug abuse or making our communities safer. Instead, we've seen soaring incarceration rates, with minority populations disproportionately affected, which raises serious concerns about fairness and justice. The focus on criminalization hasn't increased access to treatment options. Rather, it often worsens existing social and health disparities. Many critics also point out that this approach wastes valuable resources and overlooks evidence supporting alternative strategies that prioritize health and harm reduction. Overall, these policies tend to deepen social inequalities instead of helping to resolve them. When we examine drug enforcement, it's clear that minority and low-income communities are hit hardest. This isn't just about numbers. These communities experience higher arrest rates and longer sentences compared to others. Beyond just the legal system, access to healthcare and support services is often limited, making it harder for individuals to recover and reintegrate. These disparities don't just affect individuals. They undermine the broader goal of social justice and contribute to ongoing instability in affected communities. This reality makes it essential that we push for policy reforms designed to correct these imbalances and create a more equitable approach to drug enforcement. Here, we're looking at some new approaches that shift the focus from punishment to public health. One key idea is to expand treatment programs, making sure people have access to the help they need. Alongside that, harm reduction strategies like needle exchange programs and supervised consumption sites play a critical role in reducing risks and keeping communities safer. Another important consideration is the decriminalization of certain substances, which can help reduce stigma and encourage people to seek support. Ultimately, prioritizing prevention, education, and ongoing support over incarceration leads to better health outcomes and lessens the overall impact of addiction on society. To start, increasing accessibility to evidence-based treatment and recovery services is crucial. This means making sure that effective care options are available and reachable for everyone who needs them. Next, reducing stigma through public education plays a vital role. When we educate the public, we create a more supportive environment for individuals struggling with addiction, helping to break down harmful misconceptions. Another important recommendation is reforming sentencing laws. The goal here is to avoid overly harsh punishments that can disproportionately affect people with addiction issues, steering instead toward fairer, more compassionate approaches. Finally, supporting reintegration efforts is essential. Helping individuals rebuild their lives after treatment not only benefits them personally, but also contributes to stronger, healthier communities overall. To move forward in addressing addiction effectively, we need to embrace a shift toward evidence-based policies that focus on public health rather than punishment. This means grounding our approaches in scientific research and treating addiction as the complex brain disease it is. Breaking down the stigma surrounding addiction is crucial because stigma often prevents people from seeking help and perpetuates misunderstanding. By prioritizing treatment options and harm reduction strategies, we can create a more compassionate and effective system that actually helps individuals recover. Ultimately, these reforms have the power to reduce harm, promote fairness, and lead to better outcomes not just for those affected, but for society as a whole.